Would you say that somebody who has an autoimmune disease, once they're better, they're cured, or would you say they're in remission? Because when I tell people I'm cured, they say, no, you're just in remission. The only time I had an issue was after, as long as I've been eating my diet, I had no issues. I got off my diet one time in 30 years, and I felt a little comfortable, and I didn't, and not by much did I get off the diet, but I started to have issues again. And I said, well, I'm going to do what I did worked all these years, and then I went, it was fine. So, and I hear stories about people, they don't have an attack for 10 years, and then they have an attack. So if somebody is not getting an inflammatory bowel attack, would you say they're cured or in remission? What's the medically right diagnosis of that? I know with cancer, they say if it's a certain amount of years, then they consider it a cure for their rickets, but it's a little different. But what would you say about the inflammatory bowel disease?
I don't know. I can't ever give people a straight answer. I'll give you another convoluted answer. Like, for example, I'll give you a person has rheumatoid arthritis, right? And I put them on a diet and their pain goes away and they're feeling great. Okay. They're not better yet because if they go off the diet for a few meals, even if, 3 or 4 meals, the pain starts to come back. And they get it. But if they get them eating healthy for a couple of years and they're in remission, now they can go off the diet for months and not have pain. And some of them go off the diet because they don't have pain when they eat badly. But what happens is because they still have this genetic tendency to develop that problem, if they go back to their former way of eating after 3 to 6 months, they may come with a disease come back. I had one guy, right? He was a butcher. He comes to me and all I did was change his diet. And he has severe rheumatoid arthritis, right? And he gets totally well. No fasting, just diet change. I don't see this guy again. He comes back to me like 2 years later, and his rheumatoid arthritis came back again. I said, "What happened? You were well for like a year. How did it come back?" He said, "Well, I was feeling so well, and I was even tried to eat some meat again, and it didn't cause me pain. So I went back to my old diet and started eating meat all the time. And now, after doing that for 9 months, my arthritis is back." It took him 9 months of going back to eating badly before his rheumatoid arthritis came back again. Can you imagine? So this time, I changed his diet back to the healthy diet again and got all the junk out of his diet, all the oils out, all the grease out, fed him vegetables, did everything I can. And his rheumatoid arthritis did not go away. Still there after all the diet change. So then I had to put him on a fast, where I put him on a water fast. And on the 7th day of the water fast, his shoulders flared up like crazy, causing tremendous pain. I said, "We got to keep fasting now. You got to complete the 14 days because you got to keep fasting because now we mobilized some toxic waste. We got some stuff coming out." So he fasted the full, I think he fasted 15, 16 days till he felt totally well again. And then till his pain totally went away on just water. And then we slowly got him back onto eating again. And then his rheumatoid arthritis went away a second time. Much harder to get it to go away the second time than it was to get it to go away the first time. You follow me?
Yeah, absolutely. Interesting. And of course, the longer they're eating healthier, the longer it will take to come back again if they go.
Yes, yes, yes. So how do we now, to go back to answer your question? They don't lose their genetic defects that cause them to have a tendency to develop that disease should they go off the program and go eat unhealthy again. What if a person has diabetes or obesity or heart disease? We get rid of their diabetes in 3 weeks when they eat healthy, right? Are they in remission or are they totally cured? What about being overweight? Are you in remission? You're totally cured. Well, it's a semantical argument because they're totally cured if they stay eating healthy and keeps themselves thin and they exercise and eat right. But if they go back to eating junk food and fast food and put back 50 pounds, they're not, and maybe so I don't care what we call it. You know what I mean?
Sure. Now I have found
you're not supposed to be worried about that. You're supposed to stay living healthfully. And if you're not sick, you still should be living healthfully because we all have some weaknesses. We all have some genetic weaknesses we inherit. And if we don't eat healthfully, those weaknesses are going to flourish and be expressed and develop some problems. You don't escape from the laws of cause and effect.
Well, pain is a great motivator, and it's almost more difficult for somebody who never gets sick to change to eat healthy because they have this crazy thinking, when I get sick, I'll change, but until then, I'll do what I'm doing. And it's like, did you hear what you just said? When you get sick, I mean, if you change now, you won't have to deal with that later, but they don't make that connection. And it's like,
and some of these diseases are hard to get rid of in the person. And also the first symptom of a heart disease can be your death. 40% of people have heart attacks are dead on the spot before they don't make it to the hospital alive. They're dead from their first heart attack. And they never knew they had heart disease because now they're dead from it. And they're right. So that's like craziest thing.